Ever wondered why HIV and AIDS are often mentioned together, yet they're not the same thing? It's a curiosity shared by many, a question that underscores the significance of understanding the nuanced differences between these two terms. They're intertwined in our conversations, our health discussions, yet they represent distinct phases of a complex condition. So, what's the story behind HIV and AIDS? What sets them apart? And what binds them together? Dive into this video as we unravel the differences and the connection between HIV and AIDS. Scene script. Start with the basics. HIV, or human immunodeficiency virus, what does it actually mean? Well, let's break it down. Human, because this virus can only affect human beings. Immunodeficiency, because it attacks the immune system, the body's natural defense against disease. Virus, because it's a type of germ that invades cells in the body, causing illness. So, how does HIV affect the immune system? It targets a type of white blood cell called CD4 cells, which are crucial in fighting off infections and diseases. When HIV invades these cells, it uses them to replicate and spread, gradually reducing the number of CD4 cells in the body. As the CD4 count goes down, the immune system weakens, making the body more susceptible to infections it would normally fight off. Now, you may wonder how HIV is transmitted. It's not something you can catch from casual contact, like shaking hands or sharing food. Instead, it's transmitted through certain body fluids, blood, semen, vaginal fluids, rectal fluids, and breast milk from a person who has HIV. This typically happens through sexual contact, needle or syringe use, or from mother to child during childbirth or breastfeeding. HIV infection doesn't happen overnight. It progresses through several stages. The first is the acute infection stage, which can cause flu-like symptoms but sometimes has no noticeable signs at all. The second stage is the chronic or latent stage, which can last for many years without any symptoms. Without treatment, HIV eventually progresses to the third stage, AIDS, or acquired immunodeficiency syndrome, which is the most severe stage of the infection. So now you understand what HIV is, but what about AIDS? How does it fit into the picture? Well, that's a topic for another scene, but in short, AIDS is the final stage of HIV infection. When the immune system is so badly damaged, it can't fight off certain kinds of infections and diseases. But don't worry, we'll delve deeper into that next. AIDS isn't an immediate consequence of HIV, so what bridges the gap between HIV and AIDS? This question introduces us to a critical phase in the journey of this virus within the human body. To understand this transition, let's first clarify what HIV and AIDS are. HIV, or human immunodeficiency virus, is a virus that attacks the immune system, specifically the CD4 cells, also known as T cells. These are the body's defenders, the knights in shining armor, if you will, that fight off infections and diseases. Now, as HIV continues its onslaught on these T cells, the immune system weakens over time. This period can range from a few months to many years, depending on various factors. If left untreated, HIV can reduce the number of T cells to such an extent that the body can't defend itself against infections and diseases. This stage is what we call AIDS, or acquired immunodeficiency syndrome. You might wonder, how does one know when HIV has progressed to AIDS? Well, doctors typically use a T cell count of fewer than 200 cells per cubic millimeter of blood as a critical marker. Alternatively, the development of certain types of life-threatening infections and cancers can also indicate the onset of AIDS. However, this progression from HIV to AIDS isn't a given. We have a powerful weapon in our arsenal, antiretroviral therapy, or ART. If started early and taken consistently, ART can keep the virus in check, preserve the immune system, and prevent HIV from progressing to AIDS. It's important to remember that HIV doesn't automatically lead to AIDS. It's not a one-way street, but a possible path that can be diverted with the right intervention. Regular testing, early diagnosis, and consistent treatment are the keys to halting this progression. AIDS, therefore, is not an inevitability, but a state that we can prevent with proper treatment and care. Let's continue to spread this message, empowering individuals and communities alike to take control of their health and their lives. The impact of HIV and AIDS extends beyond the individual. But how exactly do they affect society at large? The societal and economic impacts of these diseases are far-reaching and profound. On a societal level, HIV and AIDS can strain health systems and contribute to social stigma and discrimination. In communities where the prevalence is high, they can also cause a decrease in workforce productivity, and an increase in poverty rates, contributing to the cycle of poverty and disease. Health systems, particularly in regions with high prevalence, often struggle to cope with the demand for care. This can lead to shortages of medical personnel and resources, diverting them away from other health issues. The strain on health systems can also impact the quality of care received by those with HIV and AIDS, potentially worsening their prognosis. Social stigma and discrimination are other significant societal impacts. Individuals living with HIV or AIDS often face stigma, discrimination, and even violence, which can affect their mental health, employment opportunities, and overall quality of life. This stigma can also discourage individuals from getting tested, seeking treatment, or disclosing their status, further exacerbating the spread of the virus. On an economic level, HIV and AIDS can have a detrimental impact on productivity and economic growth. In workplaces, the loss of skilled workers due to illness or death can lead to a decrease in productivity. Additionally, families affected by HIV or AIDS often face increased medical expenses and loss of income, which can push them into poverty. This, in turn, can contribute to increased vulnerability to HIV and other health issues, creating a vicious cycle. However, these impacts can be minimized through prevention and early detection. By reducing the number of new infections and ensuring that those living with HIV or AIDS have access to effective treatment, we can lessen the burden on health systems, reduce stigma and discrimination, and mitigate the economic impacts. The ripple effects of HIV and AIDS in society underline the urgency of awareness and prevention. Prevention is better than cure, an adage that holds true for HIV and AIDS. But how can we prevent it, and what treatment options exist? Well, let's start with prevention. Safe sex is the most effective way to prevent HIV transmission. This includes using condoms consistently and correctly and limiting the number of sexual partners. Another important method is needle exchange programs, which provide clean needles to users of injectable drugs. This prevents the sharing of needles, a common route of HIV transmission. Now, prevention doesn't just stop at personal actions. Medical interventions also play a critical role. One such intervention is pre-exposure prophylaxis, or PrEP, a daily pill for those at high risk of HIV. By taking PrEP, the risk of getting HIV from sex can be reduced by more than 90%. For those who are HIV positive, post-exposure prophylaxis, or PEP, can be taken within 72 hours of possible exposure to prevent the virus from taking hold. Now, let's move on to treatment. Antiretroviral therapy, or ART, is the standard treatment for HIV. It involves taking a combination of HIV medicines every day to manage the virus. ART doesn't cure HIV, but it can help people with the virus live longer, healthier lives. Importantly, ART also plays a preventive role. It reduces the amount of virus in the body to such low levels that it can't be passed on, a concept known as treatment as prevention. This means people who take ART as prescribed and achieve and maintain an undetectable viral load have effectively no risk of transmitting HIV to their HIV-negative partners. In essence, the fight against HIV and AIDS is twofold. We must prevent new infections from occurring, and we must treat those who are already living with the virus. Each of these strategies requires commitment, adherence, and access to healthcare. Prevention and treatment are our most powerful weapons against HIV and AIDS. And with these tools in our arsenal, we can make strides towards a world free from HIV and AIDS. Scene script. Knowledge is power, but what can you do with this power? This isn't a rhetorical question, it's an invitation, a call to action. You've been informed about HIV and AIDS, their impact, and the ways to prevent and treat them. Now it's time to use this knowledge as a weapon against ignorance, stigma, and fear. Imagine a world where everyone knows the facts about HIV and AIDS, where no one is stigmatized or discriminated against because of their status. A world where prevention and treatment are a common understanding, not a matter of privilege or luck. You can help create that world. How? By spreading the word, by talking openly about HIV and AIDS, by dispelling myths and misconceptions, by supporting those who are affected, by advocating for their rights, for their access to treatment, by educating others, especially the younger generation, about the importance of prevention, about the significance of regular testing. Your voice can make a difference. You can be a beacon of light in a world often clouded by misinformation and fear. You can contribute to the collective efforts to end the HIV and AIDS epidemic, to build a healthier, more informed society. Remember, every conversation matters, Every act of kindness counts. Every bit of knowledge shared can save a life. Take this knowledge, share it, spread it. Together, we can make a difference in the fight against HIV and AIDS.